this was a huge fiasco that happened in February. And I think it says Change Healthcare, it says it processes something around 30 million transactions per day, over 100,000 different hospital systems and providers on this system. So this is huge, right? This is one of the largest hacks we've seen in healthcare in a long time. So let's take us back to your side of it as a medical biller, Greg. So what did that look like to you when that happened? How'd you think through that process? Think about that hack and thinking through like how to get around this if you can no longer, because what happened was when the hack happened, or United Healthcare just admitted, said, hey, we can't process claims at this time, and they stopped. So basically all these millions and millions of transactions that are happening to process medical billing just completely stopped. So now you had providers, hospital systems scrambling to get compensated, to get paid for work they've done because the clearinghouse was not processing those claims and those claims are not coming back to them. So no one was getting paid during that period of time. So kind of walk me through like your thought process, high level as a medical biller. How do you handle that and think through that process to get around what was happening here?
Yeah, so we definitely experienced that. So I had seen something too along the lines of 1 in 3 Americans would be impacted by the Change Healthcare. That's market share that they had. We kind of went into emergency and crisis mode with a lot of things. So what we found out, one, there's a lot of clearinghouses that are ingrained with certain practice management. And so Change Healthcare was the preferred vendor for many practice management systems, for many EHRs, and for many payers, actually. So one of the things that we found out that we didn't have a lot of insight into previously, purely because I don't think we ever asked a lot of the questions around it, was there was a lot of payers who, no matter what clearinghouse you used, whether it was Change Healthcare or another like Waystar or Availity or one of the other bigger ones, what really was happening was a lot of these payers were exclusive to Change Healthcare. Even though they had a setup, you were set up with a different clearinghouse. That clearinghouse was then turning around and having to send the claims through Change Healthcare in order to get them to the payers.
So clearinghouse was using another clearinghouse to get their payments through.
Yeah. And
we saw that in Georgia, the big
the
Medicaid provider. They were using Change Healthcare to process their claims as well.
Yeah. And what we also found out too, especially here in Arizona where I live, some of the payers actually had their EFTs, so their electronic funds transfers, were dictated through Change Healthcare. So there were some payers that actually couldn't even release payments on the claims that they had. So they had to start cutting paper checks in order to get these providers paid.
The fix isn't more automation. It's keeping patients engaged with a human in the loop. That's exactly what we built for. As a matter of fact, that human-to-human connection is so important to us here at SynsorMed that we created a new AI tool called Simon. It's about getting patients engaged in their own care while keeping the human in the loop. A reward-based system that gets them taking their meds, checking their blood pressure, and staying active, all in a point system with leaderboards to keep them excited about their healthcare journey. It really keeps the patient and the human in the middle, but uses AI to track everything and encourage patients along the way. Hey, if you want to see it, if it fits your organization, put the link below, check it out, and give us a call if it makes sense.